Hi, my name is Dr. Tenesha Wards with Infinity Wellness Center, and I want to talk a little bit about what chronic Lyme disease is. I was asked this week by a patient to create a video. She's trying to explain it to her friends and her family, and it's hard, and it is hard. So I want to do a little history first, talking about Lyme disease, late 70s, early 80s in Lyme, Connecticut. Hundreds of kids and families and adults, but mostly kids, came down with an illness, joint pain, swollen joints, fatigue, headaches, brain fog, insomnia, anxiety, wired and tired. These kids were exhausted but couldn't sleep. And they were originally diagnosed with idiopathic, meaning we don't know what causes it, juvenile children, rheumatoid arthritis. That didn't add up for one doctor in particular, Dr. Bergdorferi. He started looking at these children's blood spots through live blood analysis under a microscope, and he found what's called a spirochete bacteria, meaning it's a spiral. And it was the original bacteria is named Borrelia burgdorferi after this doctor. The disease is called Lyme disease. So there's different strains of Lyme disease, but Borrelia burgdorferi was the first one found in Lyme, Connecticut. So they started treating these children, and many of them got better. Many of them got better with antibiotics. Some didn't. And fast forward, we now know that there is something called chronic Lyme disease. And let me just kind of talk a little bit about that. If somebody got bit by a tick and had flu-like symptoms, most Lyme-literate doctors, LL doctors, we call ourselves, who are familiar with Lyme, would say, go get on antibiotics right away. Yes, the antibiotics could disrupt the gut microbiome. We can fix that. If I got bit by a tick today, if my daughter got bit by a tick today, and she had the bullseye rash, even if she didn't have the bullseye rash, which I should mention, only 30% of cases now, it's been shown, have the rash, which is why there's so many missed Lyme disease cases in the US, in the world really, is because people depend on that rash and not everybody gets it. But even if they didn't and they got bit by a tick, inside 6 months, we do believe it can be eradicated completely. The sooner the better. Now, you can eradicate it with natural antibacterials, but antibiotics would be the quickest, fastest for acute Lyme disease. What happens most of the time is people just think they got the flu and they didn't correlate it to a tick bite. Either they didn't see the tick, they saw the tick and just didn't know. They just thought they got sick after. Ticks are sneaky. They're tiny. They're tiny. They're smaller than a pinky nail. They're like a poppy seed when they're not full of blood. They like to hang out in places we don't look. The naps of our neck where it's warm, under armpits, in the groin. They oftentimes attach to the leg and ankles in high grass. So they get missed a lot. It's also believed, not proven, that spiders and mosquitoes and other animals, blood vector animals, can spread this disease. Ticks are just what really the CDC recognizes. So we talk mostly about that. So oftentimes people don't even correlate it to any type of bug bite. They just think they have the flu. And sometimes it goes dormant after this. These spirochetes are what we call stealth pathogens. They can hide, they can burrow. The spirals can spiral into organs, joint spaces, which can cause major, major pain and issues and inflammation. These Lyme bugs like to hang out in the bladder. It's a big culprit for interstitial cystitis, inflammation of the inner lining of the bladder. So these bugs are sneaky. They're what we call stealth pathogens. So sometimes somebody gets sick right away. Sometimes they don't. Sometimes their immune system's okay, but the tick or whatever vector has introduced the bug, the microbe, into their body. And sometimes these bacteria can lie dormant, or again, you get sick and you get better, but they can still be there. So what we found as a Lyme-literate doctor, if somebody's been sick longer than 6 months to a year, oftentimes a round of antibiotics do not kill these bugs. They've become resistant. They build up what's called a biofilm, which is like a shell around them that protects them. So antibiotics can't really touch them anymore. So this is when they become chronic. The other thing I should note about these bugs, not only can they burrow and hide in joint spaces and hollow organs, they can cross the blood-brain barrier. They're small enough of microbes to get into the brain and cause swelling. This is where it gets tricky. Lyme disease is called the great mimicker for a reason. We've seen Lyme disease be the culprit of MS. So think about it like this. What is MS? Multiple sclerosing. Sclerosing is hardening of the brain. Okay, so multiple hard spots of the brain. Why does the brain become sclerosed? Why does it get hard? Because the body's attacking its own tissue. It's an autoimmune disorder. That's the definition of autoimmunity. The body's attacking its own tissue. Well, the body doesn't wake up one day and decide to attack its own brain. It just doesn't. It's doing what it's supposed to. There's an infection or a toxin. MS has also been linked to mercury poisoning and other toxic metals that cross the blood-brain barrier, and the body's trying to fight and detox it and causing scar tissue. That's what the sclerosing is. The hardening is scar tissue. Oftentimes it's from Lyme. The bugs crossed the brain barrier, the body attacked it and caused some scar tissue, and that causes brain damage. That's one thing that we've seen it look like. Another big one is lupus. A lot of patients are diagnosed with lupus, and sometimes the ANA, some of the lupus markers come back negative, but they still get that diagnosis. It's really Lyme. Lyme disease can cause autoimmune tendencies, so sometimes the ANA comes back positive, but Lyme disease is still the culprit. I would say a lot of autoimmune diseases have Lyme disease as the culprit because the body's attacking itself because it's trying to fight these bugs, but the body's not strong enough to fight them because of the biofilms they put up and the stealthiness where they can hide. So what do we do? The other one is rheumatoid arthritis. We're going to get to what we do in a second. The other great mimicker is rheumatoid arthritis. Oh, this is a good one. I've been in practice for over 18 years. I would say 17, 18 years ago in practice, all of these patients came in. That was the biggest diagnosis 15 plus years ago was fibromyalgia. Fibromyalgia, now I would say chronic fatigue syndrome is probably the big diagnosis. Both of those, I don't really believe that they are diagnoses, even though they have an ICD-10 insurance code. They're just really symptoms. Chronic fatigue syndrome. Yeah, you know you are chronically fatigued. That's just a symptom. Fibromyalgia, the definition of that is pain. It's a pain pattern, no known cause. Again, the body doesn't just wake up and have pain. There's a cause. So 15 plus years ago, 17, 18 years ago, patients were walking in every day. I have fibromyalgia. I have fibromyalgia. What can you do to help? I started running Lyme disease tests on them. I can confidently say over 95% of them had Lyme disease or some other tick-borne illness. That's a whole nother topic, but Lyme disease can have what's called co-infections, and there can be other bacteria and parasites that are infect you at the same time as the Borrelia burgdorferi. There's also many different strains now identified of Borrelia. So that was the original one found in Connecticut. So there's lots and lots in Lyme, Connecticut. There's lots of other strains of Lyme disease now too. So one of the questions this patient had is, can I heal from it? And is it fibromyalgia? It can cause fibromyalgia symptoms. It's the great mimicker. It looks like fibromyalgia. It is fibromyalgia, but there's, again, a root cause, and it is a bacteria. Is it arthritis? It can cause arthritis. It can cause joint pain and swelling, but it's not arthritis. Again, it's something else. So back to people sometimes get sick and then maybe they get well and it goes dormant. I've seen this a lot in the last couple of years. People got sick and maybe they have flare-ups of illnesses. This has been huge since COVID. A lot of people had Lyme disease and maybe they're coexisting with it. And that's sometimes a Lyme-literate doctor's goal, is bringing the infection load down, bringing your immune system up so you can coexist with Lyme disease and not have symptoms. That's where I've spent the last 30 years. I was diagnosed with Lyme disease at 15 years old. I woke up one day, unable to bend almost any joint in my body, severe fatigue, could hardly lift my head, anxiety, so that wired and tired, brain fog, missed a year of my life, went to 10 plus doctors over the year, including the Mayo Clinic. And I was first diagnosed, this was mid-90s, 1994 to be exact, with idiopathic rheumatoid juvenile arthritis. Then I was diagnosed with MS. And that's where my mom was like, whoa, whoa, whoa. Shouldn't have MS. They did the brain scan. I didn't have the sclerosing in the brain. Then they thought I had lupus, tested negative for lupus. Again, doctor after doctor, finally found a natural-minded doctor who took one look at me and said, I think she has Lyme disease, and tested, and it was. And so I tested myself 20 years later through process of natural healing, had 0 symptoms, but knew it can be crossed through the placenta. 20 years later, I decided to get pregnant. I tested myself. I would have looked you dead in the eye and said, I do not have Lyme disease. I have not had symptoms in 2 decades. The test came back negative. These bugs were still in my body, but they lied dormant. I've just done a really good job of keeping my stress low, keeping my nutrition well, exercising, hydration, like all the things to keep myself healthier than the bugs. What I've seen happen more in the last 4 years than in my entire 18 years of practice is people who got COVID and pretty severe infections. COVID is an inflammatory disease. It lowered our immune system. And these Lyme bugs that maybe the person has had for decades are like party time. And I've had more positive Lyme cases come through my doors in the last 4 years than I have in the previous 14. And so that's one way that chronic Lyme can express. It was there, it lied dormant, it's come back out. Another is the person was bit by a tick, had flu-like symptoms, or bit by whatever. Never really put it together, but never really pulled out of it. That's the other one I've seen. And I've seen patients ill for 20, 30, 40 years from Lyme disease. And in a short amount of time, we've been able to find and fix and turn that around. And short amount of time, I'm talking a year or two of treatment, 40 years of illness to a year or two. It takes some time to heal this, right? To find it. So that was another question. Can I heal from it? What's the definition of healing? Are they going to completely eradicate from living in your body for 20 years? Probably not. They've hidden, they're stealthy, they have defense shells. Now, we do use herbs that are called biofilm busters that break down that shell, and we go in for the kill. But I will note, we don't do that with a Lyme patient in our clinic until month 6 or 7 of treatment, because there's a lot that has to happen before we can treat chronic Lyme. I like to refer to it as arming the body for battle. We have to build you up before we go into this fight. We have to make sure that when we kill these bugs, first of all, your GI tract is in good shape to absorb the Lyme killing herbs to get into your system. That's the first step. If the gut's not working, if you're dealing with leaky gut syndrome, IBS, Crohn's, we got to fix that first, or you can't heal. We can't give you the herbs to heal. The other is the lymph and the liver and the detox pathways, your kidneys. All of that has to be able to get those bugs out when we kill them. So you have to have the exit strategy open, right? Or, like a clogged drain in your bathtub has to be open for the body to get rid of it. So there's a lot of pre-work we do before going into killing these bugs. And then we go low and slow, because people sometimes feel worse before they feel better. Because when you kill these bugs, that biofilm, that shell, lets off is broken down and is in your system. And your body looks at that as a neurotoxin. It's doing what it's supposed to do. There's something in the system now that's causing inflammation. So the body rushes to it to try to heal or try to flush it, and that causes pain and inflammation. So we do a lot of work also to get the body ready for that. And we go really low and slow. If that happens, we pull back on treatment and we go slower until the body can really handle what we call the die-off. That whole cascade of feeling worse is called a Herx reaction, after Dr. Herxheimer. So I hope that was pretty comprehensive of what Lyme disease is, how we handle it in our clinic, the difference between acute and chronic, and when to treat them differently. If you have any questions, please reach out. I've completely dedicated my entire adult life to studying these bugs. I've learned to respect these bugs. I've learned to outsmart these bugs, because they are smart. They are stealth pathogens, and they are smart, and they like to hide, and they like to attack. They can attack any part of your nervous system. That's another thing worth noting. The way they go dormant and the way they hide very much presents like a virus, even though they're a bacteria under a microscope. And the way they attack your nervous system is very much parasitic. It's like a parasite. So they're tricky little bugs. They can attack anywhere. They can hide, they can get out of your bloodstream and go into your cerebral spinal fluid, and they can attack any organ at any spinal level. So they they're a practitioner's nightmare. They're hard to diagnose. Testing is not 100% accurate. The best tests out there are about 95% accurate, which is still better than they were 10 years ago at 60%. Most traditional lab tests are not very accurate that you'll get. They're about 60%. So there's very specific labs that we use to test them. So again, I've learned to respect them and to try to outsmart them every single day, because they can absolutely ruin people's lives and wreak havoc on your nervous system and affect everything from your thyroid function to your hormones, to your gut, to your brain, to your joints. And so I hope that answers the questions. Any questions about Lyme disease, please reach out. I'm happy to try and help. Again, Dr. Tenesha Wards with Infinity Wellness Center.